Your children are experiencing allergies and asthma symptoms. Optumcare Lung and Allergy Care, the sponsors of this segment, are here to help.
Dr. Vinuya, welcome back.
Thank you. Thank you for having me back, Rocky.
Oh, yeah, of course. I'm sure people are keeping you busy over there, especially with the allergies going on in the air in Vegas right now.
Oh, yes, it's that time of the year.
It is that time, but we're talking about allergies and asthma for children in particular. So let's start with asthma. Let's define that for everybody.
Sure. Well, there's so many kinds of asthma, but 60% of asthma, depending on who you read, is allergic asthma. And asthma is described as inflammation, meaning swelling and accumulation of mucus in the airways, which causes it to constrict or to narrow, causing symptoms of difficulty of breathing, wheezing, coughing, and sometimes chest tightness.
Okay, and are allergies and asthma, do they go together? Are they related at all?
Up to 2/3 of the time they do, meaning if you have allergies, you are 3 times more than likely to develop asthma at any time. So that's how they are related, because the inflammation from your nose and your upper airways has a direct relationship to the inflammation in your lower airways, which is what asthma is.
Okay, and what can trigger asthma in children?
There's so many triggers, and everybody's asthma is very unique to that person. But the most common triggers include when you get sick, so respiratory tract infections, exposure to the things that you're allergic to, or sometimes irritants like smoke, and sometimes very vigorous activity.
And of course, during this time, respiratory illness like COVID could potentially affect that as well. What are the symptoms of asthma for children? What do they see first?
The most common symptoms, again, and these are very specific to the person. Some people experience wheezing. Some people have difficulty of breathing, some experience chest tightness, and others have just a cough that leads to difficulty of breathing. Yeah,
it's so difficult to deal with, especially for children who haven't fully developed yet, right? What are the treatments that children can have for asthma?
The treatment for asthma will consist of 2 classes. One is a rescue, meaning you take this medication when you have a problem. It's like taking Tylenol for fever. It's called albuterol. It opens up your airways momentarily. And then the rest is called controller medications. These are medicines that you take every day to control your asthma so that the chances of you needing your rescue will decrease. But one of the most important things is that together with asthma medications, you should also control your allergies, because that is directly related to your asthma.
So make sure you take care of those allergies first and foremost if you're seeing them, and hopefully that can prevent the asthma.
Correct.
Okay, we got it. Well, thank you so much, Dr. Vinuya.
Thanks again, Rocky.
All right, see you soon.
All right, thank you, Optumcare Lung and Allergy Care, for sponsoring this segment. They have locations across Southern Nevada. Give them a call at 702-724-8844 or visit optumcare.com/NV Lung. We'll be right back right here on